Overlabeling of things has gotten way out of control. Two points I want to make though before we launch into this. One is be careful what you wish for. I always wanted to raise awareness about mental health. Lo and behold, it has been sort of it's been hashtagged. It's become peer pressure. And the other point I want to make is let's be clear that lockdowns predicted an increase in mental health issues, particularly depression, anxiety, in young people. We destroyed an entire generation of young people. And so, of course, we're going to see more of this. But even given that, we've become excessively preoccupied. People need to understand that these terms mean, first of all, almost nothing outside of very carefully trained clinical hands. And number two, if it's not impairing functioning, it's probably not an illness. This is the thing. It could be uncomfortable. You know, I think I mentioned these to you once before, that when Sigmund Freud got to this country and the reporters put a microphone in his face, he said, what is it you plan to do here, Dr. Freud? And he said, well, I hope to understand the difference between true mental illness and ordinary misery. We have become a country that is unwilling to tolerate the ordinary misery of living.
Forget ordinary misery. People don't want to be uncomfortable. And I guess that's the next question, right? Because almost all of the social media psychiatry that exists pushes, perhaps because of economics, mostly drugs and sometimes interventional therapy. I've done at least a little bit of research for this program over the past few years, and some even before that, and it shows that for lots of forms of depression and anxiety, exercise, especially really intense anaerobic exercise, is almost as effective as drugs, but I guess the reason we don't hear about it as much is because there's not as much money to be made from it, right?
That absolutely has to be some of what's going on here, for sure. We have over-medicalized, over-pharmacologized everybody. Look, medicines have a role. Do not get me wrong. They can be life-saving. They can be exquisitely important. And they're also, at the same time, overused. And people, because they expect pills to be a solution to the ordinary misery of living, they make grave error on two fronts. One is medicines are dangerous. We've just lost track of that. And only when the risk reward is worth it are medications something that you should be contemplating. The other thing is that ordinary misery is motivating. It builds up efficacy and the ability to respond flexibly and with resiliency and grit, the things that we hope to sort of create in a healthy society. And we've just let that behind to this sort of passive fix me because I need to feel better. And that is a problem. It's a problem.
Look, the pendulum always swings too far, right? We saw that with the opiate crisis in America. It swung so far of overprescription, and now all of a sudden you have a knee replacement and they say take 2 Tylenol because we don't want you to be addicted to opiates. Where is the line, right, for people who say, okay, I've listened to Dr. Drew and I have grit and I have resilience and I want to be strong, but boy, I really need some help, and the exercise isn't doing it for me. At what point do people say, okay, there's a point where taking some pills, maybe for a limited period of time, can really help and is worth the risk?
Absolutely, 100%. And the easy sort of threshold to look at, as I mentioned earlier, is functioning. Am I having trouble functioning in any area of my life, socially, interpersonally, with work, my legal status? Am I not taking care of my health? Am I sleep disrupted? And it's going more than a couple of weeks? That is a time. Or are there serious symptoms? Am I thinking of hurting myself? Am I no longer taking care of myself? Am I hearing or seeing things? And by the way, it's very important to get a medical evaluation when you have these serious symptoms, because oftentimes there can be a medical problem, if not contributing to these symptoms. So it really is important to get into skilled hands. The other issue is if you do meet criteria for a bona fide illness, trying to find a psychiatrist in this country right now is daunting. That we have a grave shortage, and that's the next threshold. So we're both underdoing it and overdoing it, right? We're underprescribing, undertreating, and overprescribing and overlabeling. It's the worst of both worlds.
Yeah, you stole the words right out of my mouth in terms of how difficult now it is to find really good, really competent mental health care from people who care and who have the time, as you've always pointed out, the time to go through with people and figure out really what's wrong and really how to help. Your perspective is always an important one, sir. It's good to see you as always. Thank you.
Appreciate it.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.